Mary Greaves's brother Peter had a hip replacement in January last year.
He was one of many NHS patients treated in a private hospital. An inquest found he wasn't transferred to an emergency unit quickly enough when his condition worsened. Matthew Bone reports.
I came back home and I just walked in the door here and the phone was ringing and they were saying, "Can you come back? Your brother's gone into cardiac arrest and we're trying to save him." He never regained consciousness and died 2 days later.
Mary's brother had a hip replacement paid for by the NHS but done in a private hospital. An inquest found Peter's operation had gone well, but when he became ill during his recovery, mistakes were made at Beaumont.
Unlike many NHS hospitals, private hospitals don't tend to have an emergency department on site. That's the case here at the Beaumont. So if there are complications, patients are transferred back to an NHS hospital. The inquest found that, in Peter's case, that didn't happen quickly enough.
BMI, which runs the Beaumont Hospital, said in a statement, "Our condolences remain with the family and friends of Peter O'Donnell. In the 20 months since his death, we have made a number of changes at the hospital. Our principal objective is to provide safe and quality care for all our patients." But Mary says it's wrong to perform these kinds of operations if there's no emergency department at the site.
All surgery is not without a risk of some sort. There needs to be some emergency facilities in places.
Hundreds of thousands of NHS operations are done in private hospitals every year to help deal with waiting lists. Supporters of outsourcing say standards can be higher in private hospitals, and as long as the right procedures are followed, it's safe to transfer patients who end up needing emergency treatment.
For many surgical procedures, and the vast majority, frankly, that they can be treated safely in a hospital without intensive care facilities, providing that the preoperative work is done properly, the screening is done properly, and the right patients are seen in that facility.
But the right procedures weren't followed for Mary's brother, and the consequences have left a big hole in her life.
It's difficult to accept a death when you know it might never have been. It's just sad, that's all. I just find it really, really sad.
Matthew Bone, BBC North West Tonight.
Well, critics argue that some operations, like hip surgery, shouldn't be privately outsourced. One of those joins us now. It's Colin Leys from the think tank Centre for Health and the Public Interest. Ms Leys, thank you very much for joining us. Do you believe that private hospitals should have an emergency department on site?
I think any hospital doing serious surgery should, yes, because from time to time there will be a crisis, there will be a problem, and if you don't have it on site, you hugely increase the risk.
Obviously, this is a very sad case, but there are lots and lots, hundreds, thousands of NHS patients treated in private hospitals every year. Things very rarely go wrong. Is there any real evidence that private hospitals aren't as safe as NHS ones?
No, I think we can't have evidence because the patient mix is different. The private hospitals without intensive care facilities and without surgical teams on the site are only supposed to take relatively healthy patients, whereas the NHS patients is a huge mix, including people who are high risk. So you can't compare the statistics. All we have is the fact that if something goes wrong in a private hospital without intensive care facilities, then you have the additional risk.
So are you saying that there should be no outsourcing of NHS patients to private hospitals at all?
Well, that's a different question. Personally, I'm not in favour of it. I think the NHS ought to be comprehensive. It ought to be able to handle all of us. But all I would say is that if it is to outsource, it must outsource to places where NHS patients will be at no greater risk than they would be in an NHS hospital.
Yeah, I mean, the thing is with outsourcing them, it does shorten waiting lists, it does help patients, it frees up patients. What is the problem in your mind then about outsourcing them?
I think it needs reframing. The idea that private sector helps out the NHS is quite problematic. In the first place, the NHS heavily subsidises the private sector in a variety of ways. And secondly, if the resources that are now being spent on treating over 500,000 NHS patients in for-profit hospitals were devoted to expanding NHS facilities, the whole argument about helping the NHS out wouldn't stand up.
OK. Colin Leys, thank you very much indeed for your time this evening.
You're welcome.
Now, there'll be more on this story at 8 o'clock tonight on BBC Radio 4 when File on 4 investigates safety in private hospitals.